Alright guys, we are back with actually writing the prescription. So this is the same assignment that we did on the last video. And we did this first one together. If you did it with me, you know that each dose came out to 2.5 mLs for a total of 2.5 mLs per day. And our total to dispense is going to be 75 mLs. Okay, so that was the very first one that we did for aldactone. So how do you write the prescription? Well, this is what your regular script pad is going to look like. If you're actually writing prescriptions, you know, a lot of offices have gone electronic now, so that does change things a little bit, but it won't change it entirely. We still have to know what information to put into the system to get it ready for the doctor. And that's really no different than writing it. You're just putting it into the computer system. So in this case, the doctor ordered 125 milligrams of aldactone to be taken every day, QD, as a maintenance medication, 30-day supply. Patients should take this medication with food and allow for 3 refills. So we're going to go on to the rest of the words that are in this word problem. First of all, when you write a prescription, you have to write it how the medication comes. Okay, so how does the medication come? Remember, that was in our medicine cabinet up here. So aldactone uh, 250 milligrams per 5 ml. 250 milligrams /5 ml. Okay, probably should have started a little over there. SIG. SIG, okay, colon means directions, or take thou, okay, so it's directions. So this is where our directions go. This is where we tell the patient how much of this medication, the way that it comes, to take in order to get the doctor's orders. So remember, it said 2.5 milligrams, 2.5 ml. Don't make that mistake. 2.5 ml was our per dose. Okay, QD, right? PC. PC is with food or after meals. So PC, the definition for PC is usually after meals, which in this case is how we would write it to say with food. You could also maybe see it W/FOOD, okay, with food. Or you could see it, a C with a line over it, FOOD. Okay, both of those could mean with food. Okay. However, again, most of the time for pharmacy purposes, it'll be PC, which means after meals. And then the number sign is going to be for the total quantity that we're going to give the patient in the bottle. So the total quantity for this patient for a 30-day supply, because it's a maintenance medication, is 75 ml. Anytime you have a quantity, you have to spell it out and put it in parentheses on a written prescription. Okay? That's important because how easy would it be for somebody to take a pen and go like that and make it 175? That would be fraudulent. That would be somebody trying to get more medication than they were supposed to. And that's why it's important to spell out the quantity and put it in parentheses. You're also going to do the same thing for refills. So when it says allow 3 refills, you can put the number 3, but then you also have to spell it out. 3, and put the parentheses. Never sign. Never sign for a doctor, ever, ever, ever. Okay, that's only for the doctor to do. Sometimes on maintenance medications, the doctor will have a stamp in the office that they'll allow you to use, a signature stamp. I don't recommend that, but once you've worked with a doctor long enough, if you've developed a really good rapport and a good relationship and trust factors and things like that, sometimes they'll keep a stamp in the office to use for things like maintenance medications. Things like high blood pressure pills, cholesterol medications, diabetes medications, things like that. Don't ever use that stamp for something that's controlled. Okay. you would have to fill in the patient's name, today's date, patient's address, and the date of birth. Remember, that's all very important. The name must match, so make sure you've got the legal name and not the nickname. Remember, in an office, sometimes we use the name that the patient wants to be called because that's good customer service. But when it comes to writing legal documents like prescriptions, you need to have their legal name. Their address is important because a lot of pharmacies will not fill a controlled substance prescription if they are not within the same zip code of where the patient lives. And the date of birth is also very important for patient identification matters, and it helps to know if this patient is a child, to make sure it's kind of a check and balance system where the pharmacist always double checks the prescriptions written for children to make sure that it's not written too strong for a child of that age, or not enough for a child of that age, those kind of things. Okay, so that is our first prescription. The next one we're going to go over is the Lasix, number 2, the Lasix. So it's right on the back. Okay, not sure if we did this one together or not, but you should have done it by now. So I'm going to get rid of this. Notice I'm leaving the SIG and I'm leaving the number sign and all that because that's pretty standard on all prescriptions. It may not be written on there. You might have to write it, but that's what you would do. All right, so Lasix. Doctor orders 500 milligrams of Lasix to be taken BID for 30 days, no refills. All right, so our Lasix comes how? 250 milligrams per ml. Lasix, 250 milligrams per ml. Lasix, 250 milligrams / ml, right? Okay. And when we did the calculation, we know that the patient must take 2 mLs per dose. Patient is taking this BID, that's twice a day, for 30 days. So again, it's a 30-day prescription, and it says no refills. So 2 mLs per dose, 4 mLs per day, and it came out to 120 mLs for the entire prescription. So per dose, that's where your instructions, per dose, okay? Going to take 2 ml, okay? And this is by mouth, twice a day, BID, for 30 days. Now, usually, if it's a maintenance medication, we don't have to put the times 30 days there. It'll just always be a month prescription at a time, which is 30 days. But maybe this isn't going to be a forever medication. So maybe the doctor only wanted the patient to take this for a month, so they specified for 30 days. What was our total? Our total was 120 ml. Spell it out. 120 ml, and this said 0 refills or no refills, a 0 with a line through it, and then spell it out, 0 in your parentheses. This one you don't have to put in parentheses so much, it's probably not as important, but I usually do just because it's the way to do things, okay? All right. And I'll do one more with you. The longer these videos are, the longer they take to upload, and I'm wondering if that's why the last one was blurry. So I'm going to try not to go as long on this one. The next one we're going to do is the Benadryl. Okay, Benadryl. The doctor ordered Benadryl 225 milligrams, TID for 10 days, no refills allowed, dispenses written. That's why I want to do this one, because we're adding that dispenses written. So this is the one that we did 2 different ways to see which one would be the best for the patient, and we decided to go with the one that was 1.5 tablets per dose. So the 1.5 tablets per dose gave us a total of 4.5 tablets per day, and that was a total of 45 tablets for the entire prescription. All right, so again, doctors ordered Benadryl 225 milligrams, but we are using the Benadryl 150 milligrams, okay? So we have Benadryl, 150 milligram, and this was tablets. Yes, tablets. 150 milligram tabs. Okay. So the directions, right, are going to be to take 1.5, okay, or 1.5 tablets, tabs, TID, right, that's 3 times a day, times 10D. That'll be for 10 days, all right? So this is where we get into the total, which was 45 tabs. Okay, spell it out. 40, that's not right. If you're not sure how to spell your numbers, it's okay to have a cheat sheet. 45, okay, in parentheses. Dispense as written was the last part on that prescription. DAW. DAW. What that means is the pharmacy cannot give the patient a generic brand instead of the brand name. Okay, it was written as Benadryl, it needs to stay Benadryl. Now this could go the other way around too. Sometimes patients do better on a generic medication than they do the brand name. So in that case, the doctor would still write dispense as written, but they would put the generic name instead of the brand name. Okay, so dispense as written means don't substitute this for anything, don't change anything, give the patient exactly what I've written on the order. Okay. Almost every pharmacy will always give you the generic instead of the brand because it's cheaper, which means the insurance will usually pay for it. If you try to get a brand name instead of a generic, the insurance most likely will not cover it. The patient would have to pay for the whole thing, excuse me, unless they can prove that the generic is not working for them. And that's going to be your job. Guess what? Okay, that's an MA's job. We have to get on the phone with the insurance companies. We have to provide all the proof and fill out all the paperwork and go through all the push-ups to prove that the patient is not doing well on the generic, and that's why they need the brand name so the insurance will cover it. There's a lot of hoops that you got to jump through to get that to make it happen, but you can do it. No refills are allowed, so that, again, this was a 0, Z-E-R-O, okay? And there you go. So writing prescriptions is really about making sure that you remember that this is how the medication comes. This is not what the doctor ordered. This is how we are going to get to what the doctor ordered, based on how the medication comes, okay? So whatever's in the medicine cabinet, that's what has to go here. Whatever the pharmacy has on the shelf, that's what has to go here. This is the directions we give to the patient, okay, in order to reach the dose that the doctor wanted, and again, the total medication to give for this prescription. Never sign for the doctor. Okay, I'm going to stop the video there. We'll do some more later, but I want you to continue on with this assignment now and try to get it on your own.